episode with me is my dear sister. And by the special grace of God, we have a wonderful guest speaker all the way from New York, and by the name Dr. Kandace Reece, a general psychiatrist. Dr. Reece, can you please say a little bit about yourself? What would you like us to know about you, please?
Hi, how are you? My name is Dr. Kandace Reece. I'm a general psychiatrist in Westchester County in New York. I specialize in consultation liaison psychiatry, which is basically treating the medically ill patients in the main hospital who have psychiatric. I also have an interest in palliative care and end-of-life care.
Oh, thank you very much. So it's nice to have you on board. We appreciate your time. I will refuse to take that for granted. So we'll go straight to what we have before us today.
So, we're going to be talking about mental health, as my host has said earlier, and I want us to talk about what comes to our mind when we hear the topic mental health. Could it be negative or positive?
Well, in regards to mental health, the way that I look at it is just like your physical health. It's just as important as your physical health. So you need to have your spiritual health, your physical health, and your mental health. Just like we get sick with a cold or diabetes, we can get sick, mentally sick, with depression, anxiety, psychosis, mania, and we have to remember that the mind, body, and spirit are all connected. So when one is off balance, the whole system is off balance.
Okay, so what exactly now makes mental health different from the physical health, and why should we pay attention to it?
Well, like I said, I don't think that there's much of a difference. Unfortunately, the way people see it is that mental health is a whole different area of health. But really and truly, like I said, the mind, body, and spirit work together. So we really do need to pay attention and be more aware of our feelings, what makes us upset, what makes us happy, what throws us off balance, where we may be treating others in a negative way. We have to be aware of our own self-talk. How do we talk to ourselves? Do we, speak negatively to ourselves? Do we speak positively to ourselves? And in turn, how does that affect the people around us? How does it affect our relationships with our spouses or even with our children?
Thank you, Dr. Candice. So I had a question. When we talk about our body system, I know we talk about our renal system, our cardiovascular system, and other part of the body. In the real situation, how important is mental health to our system? I know we've talked about the whole body, but I just wanted to educate our viewers about the way we take care of the system as well as mental system.
Well, I think the first thing that we have to remember is, we have to take care of the body on a whole. So you have to be very careful about what you're eating, what you're drinking, what you're watching or scrolling through, the amount of exercise that you're getting. All of these things that we do on a regular basis affect our mental health. So if we are, for example, in our free time, all we do is scroll through Facebook, that has an effect on your mental health. You may not realize it, but a lot of times when we're scrolling through, we are coveting or being jealous of someone else, or look at what this person has and comparing ourselves to others. And that in turn makes us feel down or makes us feel bad. And if you're doing this over, time, over months and years, it eventually does have an effect on you. If all you're eating is fast food and junk food and candy, that has an effect on your body. And, you know, there's a rising rate of obesity, lack of movement. Even children are not going outside and playing like they used to anymore. All of that has an effect on our mental health. Maybe not right away, but after years and years of this abuse that we put onto our body, eventually our brain chemistry can start to change, and we can start experiencing things like depression and anxiety.
It's very interesting that you had to talk about all those things, regular things that we do without really paying much attention to it, that this might have an impact on our mental health. So now you're talking about this, when this continues to happen constantly, persistently, then it affects our mental health. So here's the question. So what over time, what are the signs to look out for us to know that, okay, this has gone into this point? There should be some signs, early signs and symptoms to look out for. What are those signs?
First signs you can look at is your sleep pattern. Are you having difficulty falling asleep and staying asleep? Has your sleep pattern switched, where you're, instead of being awake during the day, you're awake at night and sleeping throughout the day? Are you starting to become very irritable with people around you? Are you starting to not be able to be as productive at work? Or are you forgetting to take care of things at home? These are all things that we can use to measure our mental health. We also have to think about, in some cases where people have some psychosis, which means that they're hearing voices or having experiences that are not based in reality. So you have to look out for those things as well. If you're hearing voices or seeing things that are not there that other people can't see, you definitely should be talking to your physician about those things.
That is so important. Um, Still on this symptoms, is there anything that makes one more vulnerable than the other person?
There are people who have family history of mental illness. So those people will, I don't want to say automatically, but basically they have a high genetic burden, which means that they are more susceptible to having mental illness. But if they take care of their bodies and are very in tune with themselves and aware that has been an issue in family members, and they're able to take care of it from the very beginning, it's something that could be controlled and you can live with it.
So I just want to take it back a little bit, because it's kind of, you said something that is kind of a little bit scary now, because you're talking about sleep patterns. So you finding yourself sleeping during the day, when we all know that you're supposed to sleep at night. But come to think of it, in this world, or this part of the world where we live in, where people get a job that they see that it's a blessing, but then it has an impact on their mental health. So what do we have for people like that? Because when they work night shifts, and of course, the only time available for them to rest is during the day. So people in that category, what advice would you have for them?
So for people in that category where they have to work at night while everyone's sleeping, I think we all have to do what we have to do to take care of ourselves and take care of our family in regards to making money. But you do have to realize that having a reverse sleep cycle, even if it's because of work, over years has a long-term effect. Studies have shown that people who work nights and sleep during the day have a higher risk of diabetes, obesity, high blood pressure, sleep apnea. Um, but so people who work at night have to be more conscious and aware that they're at risk for physical as well as mental issues.
So how do they handle that situation to still maintain that life balance? How do they?
Still, if they have to work overnight, it's important that you get exercise and that you're eating at specific times during the day or during the night. Um, Trying not to be snacking all throughout the night when you're awake. Try to have breakfast, lunch, and dinner, even if it's a reverse breakfast, lunch, and dinner. Um, Trying to stay on a schedule as opposed to having a very erratic schedule where you're not, where your hours are variable. Say you're working 3 to 11 one day and then 11 to 7 the next day. You want to try to stick with one schedule so that your body gets into a rhythm. And you cannot neglect the exercise and the eating right, and that when you are sleeping, that your sleep is a restful sleep. So you're turning off your phone, you're telling your kids not to bother you, you're having the blackout window blinds so that there's no sun coming in. Those are very important.
Yeah, thank you so much. I can testify to that. I used to work night shift, and I remember I used to eat all night to stay awake. I have to eat sugar, otherwise I'm gonna fall asleep, and I gained a lot of weight. And I had to check on myself, okay, do I really want to continue snacking at night, or what else can I do? But unfortunately, I didn't find other solution. I just tried to control eating to stay awake, because I'll pack a whole bag of food to snack on just to stay awake. So thank you for telling us that. My next question is still on the signs and symptoms. I know you talked about our sleep pattern, irritability, and other things. So I want to talk about irritability. Can we control this when it happens on our own?
Cannot control it. It's beyond our control. It's like, when you reach the end of your rope and you don't have anywhere else to turn. You've been praying about it, you've been asking God to help you, and I believe that God will help you. But just like with diabetes or high blood pressure, you take some medicine for it, or you take some, you change your diet, or you do something to help yourself. I think that God put doctors and pharmacists in place to be able to give us therapies, whether medical or, you know, like therapies, like talking about your issues. God put those people in place to be able to help. So the irritability, when you get to that point where you just feel like you have nowhere to turn, and that you feel like you're in a desperate situation, it's hard for you to be able to control it on your own.
So is it possible for you to be having these problems of mental health and not know it?
A lot of us feel like stress or feeling stress is the normal. Like everyone feels stress. While that's true, we do need a little bit of stress to help us motivate us to reach certain goals, and we have to use, like in a fight or flight situation, we need a little stress in order to help us to protect ourselves. But when this fight or flight or this stress levels are on 100%, 24 hours a day, 7 days a week, it's very detrimental to the body.
All right, thank you very much. So, well, I just want to ask this question: like, at what point do you think one gets to that there will be no solution? Because now, as you were talking about you're talking about ways that we can help deal with situations. So, but at what point does it get beyond help?
Find that over, I think, like I said, we all deal with stress. We all have feel a little down or a little anxious sometimes. But if it's getting to the point where you're unable to take care of yourself, take care of your family, if you're not, paying your bills on time, if you're not getting along with people at work, and if you just feel very miserable or uneasy within yourself, you need to get help. And it's, we all have a different tolerance for dealing with stress. But if it's at that point where you start to have maybe even intrusive thoughts about not wanting to live or wishing you could just run away from everything, at that point you're even beyond the point of having needed help. It doesn't mean that you're beyond, like, medicine or therapy couldn't help you, but you probably should have gotten medicine or therapy earlier on.
So do we just watch people like that, like take take very drastic action, like taking their lives, because it looks like it's one of these things that results in suicides. So what do you do in that regard? You can't just watch people die just like that?
Usually what I've noticed is that before people get to the point of suicide, they usually will try to self-medicate. Overeating, drinking alcohol and getting drunk, taking drugs, getting addicted to certain behaviors that are detrimental to the body. Usually people will try to self-medicate before they get to the suicide point. They don't wake up one morning and say, I'm just gonna kill myself. They usually try to do stuff before that time. But if you see that there's someone in your inner circle who seems to be suffering, you should definitely encourage them to get help. If it ever seems that they are a danger to themselves or to other people, at that point you should definitely involve doctors, hospitals, call 911 and get them the help that they need as soon as possible.
Thank you, Dr. Kandace. So that will lead me to the question, even though I have another question, but because of our time, let's talk about the stigmatization that is associated with mental health. I know a lot of people don't get help because they don't want to be labeled, they don't want people to think they're not all right.
Right.
I know it's a big issue within my community. So what can we tell people? How can we get out of this?
So this is something that I find um, it's a little bit difficult to handle the stigma. But I do believe that the more we talk about it, the more that we are open with each other about the things that we're dealing with as a community, the less the stigma will be. So, we could be in church and we're so and so's family and they look like they have it all together. But behind closed doors, it's a whole different story. There's so much, despair within this family that looks so glamorous. And it's the same way with these celebrities. Celebrities or people who have a lot of money, they, flaunt on Instagram and Facebook and on all over social media, but really they're lonely and they're hurting. So we have to remember that everybody has a story. Everybody has some issue that they're going through, and we shouldn't be ashamed to go get help for it.
Thank you very much. Like this has just been really very impactful. But as a parent now, let's come down to our homes. As parents, how and at what point do you think it's important that you start educating your children about the subject mental health?
From as soon as they're able to start talking, at the age of like 2 or 3 years old, you should be trying to help your children identify their feelings. Um, if a child is crying, oh, you're crying, you must be upset. I think you're upset right now. I'm sorry that you're upset. How can I help you? Trying to allow your children to become more expressive about their feelings, their needs, their desires, and also to let them know that it's okay to cry, it's okay to be angry, but it's about how we respond to our inner feelings that really matters. I think also as parents, we need to be very open with our children in every aspect so that they're not afraid to come to us if they are going through things as they get older.
Thank you very much. Before we actually wrap up, because a scripture in the Bible just came to me, and tells me that that's exactly what David went through. You know, when he got back, he went on a mission. By the time he got back, everything that belonged to him had been taken away. So he was distressed, and the first thing he did was to inquire of God what he could do, because at that point the pressure was already on him. So, because you mentioned something during what you were saying during your talk, that it's good when we pray about it too. But we all know that even faith without work is dead. So when you pray, there should be certain steps that you need to take. So can we just take a little recap to address people that are yet to identify those? I believe that from what we have discussed so far, most people would have been able to tell whether, oh yeah, this is really happening to me or not. So what about those who are already in it? Let's just enumerate a few things how they can help themselves out of the situation before it gets worse.
I think it depends on what they're dealing with, and what they're going through. First, you should never go through these trying times alone. Even if you can find one person, and that person doesn't have to be your friend, doesn't have to be related to you. It could be a social worker, it could be your primary care doctor. Somebody needs to know what you're going through. At least one or two people need to know what you're going through. The other thing is, a lot of times you don't have the emotion when you're feeling very down or sickly. You don't have the motivation to get help, and sometimes you just have to ask. You may not have to go searching, but if you can ask and say, "Hey, I need help," I feel that God will put certain people in your way so that you're able to get the help that you need. And then, of course, you need to take care of the physical body. So, getting up and moving around, exercising, listening to positive music, reading your Bible or reading, positive things, filling yourself with spiritual and positive things can really help you to overcome that initial, it could be the first step towards your full body wellness.
Thank you very much, Dr. Kandace. We really appreciate this time. It has just been a very short moment, but you've dropped a lot of nuggets. I had my paper here thinking I was going to jot some points, but I think I will still need to sit down, go back, and watch this over and over again so I can take my time to take the notes down. So, Dr. Kandace, on behalf of Proclaimer Christian Drama Ministry, we appreciate your time you've taken to join us on this episode. I would look forward to seeing you another time again. We appreciate you. Do you have one or two things for our viewers?
To be here.
You want to share one or two things with our viewers before you leave?
I just want to say God bless everyone. I know we're going through a very trying time in the world right now. And God said to look up because our redemption draweth nigh. So whatever we do, let's do it for the honor and glory of God and know that Christ is soon to return. Be blessed.
Thank you very much. God bless you.
Being a very, very educative session. Honestly,
To be honest with you, I think I was at first I was scared because I knew how long it took me when I worked night shift. So I was very, very, very scared myself. Like, okay, So it looks like I've been carrying a bag of problem without even knowing it.
Well, we've been educated. We have to take care of ourselves. Stop watching Facebook.
Yeah, Facebook and for you, no one says don't work night jobs, but you know that that's a reverse. What you call it again?
Sleep pattern.
Yeah, reverse sleep pattern. So you should be able to find a way to adjust yourself, a little bit of exercise, and of course back it up with prayer. So both you can use both spiritual and physical approach to deal with any mental situation we are going through, and we hope that you are all blessed. Thank you for joining us again on this month's episode. We'll see you again. God bless you.